Good morning. I'm really sorry I'm not able to be with you today. Thank you very much for inviting FairLife Lung Cancer Care to the present conference and for giving us the floor to speak about the value of early diagnosis in the life of patient. Sharing our remarks with each and every one of you is an honor and a privilege. Cancer is still a grand challenge, a challenge for research and innovation, a challenge for scientific communities, and naturally the biggest challenge for people and their families impacted by the disease. Cancer is also a major social and economical issue, with direct and several effects both for the patient and for society as a whole. Needless to say that apart from high financial cost of treatment and the inevitable physical symptoms, cancer often threatens the social well-being of patients, survivors, and caregivers, as well as their emotional balance. So, how do we address this special aspect of the disease? A first step is by raising awareness about the important but often overlooked approach cancer treatment, the patient-centered approach. Patients have needs. They need to communicate their feelings and fear and to be understood throughout their illness. They need to be heard throughout the treatment and they need to be respected for the end-of-life care. A second step is to ensure cancer care is both clinically optimal and patient-centered. Also to reduce inequalities regarding access to innovative treatment and special care. Despite expectation to the contrary, health inequalities are increasing in many of the world developed countries, and we have to wonder, is this acceptable in the 21st century? The fight against cancer undeniably remains a top priority worldwide, with significant progress and many advances in treatment care over the past 10 years. And yet, nothing is more valuable in cancer treatment than early diagnosis. People diagnosed earlier with cancer are more likely to have lower treatment-related morbidity and improved quality of life compared to those diagnosed at an advanced stage. Early detection translates into more cure, longer survival, lower cost of care. Patients can live healthier and longer lives when disease is detected early. Diagnosis leads to knowledge, and knowledge is power. When patients are aware of their condition, they might experience a sense of self-control which allows them to plan their lives accordingly. On the other hand, later stage diagnosis needs more extensive treatment which lead to difficult and lasting side effects. Being diagnosed at the advanced stage may lead to unnecessary suffering and limited ability to provide successful treatment. This applies especially to lung cancer, the invisible cancer, which is usually diagnosed late and is by far the leading cause of cancer deaths. We would like hereby to point out the necessity of extending cancer screening programs to include lung cancer in the Greek National Cancer Prevention Program Spiros Doxiadis. This is based on American and European researches, as well as the study conducted for the first time in Greece by the Health Policy Institute and FairLife. The study findings were presented last November in our conference and documented a 25% mortality reduction by lung cancer screening with low-dose CT scan. Lung cancer screening implementation is therefore imperative, and we have to act fast. Another important issue is the stigma associated with lung cancer due to its close relation to smoking. Reducing the stigma is also a priority because it directly impacts research funding and support available to patients. At the onset of COVID-19 pandemic, several medical procedures were put on hold so as to reduce the risk of the virus spread in healthcare facilities. Moreover, unfortunately, many people avoided medical routine care during the pandemic because of concern about COVID. As a result, many opportunities of early detection were missed. But cancer does not wait, and there should be a policy intervention to prevent the effect of delayed diagnosis and care. So it is not an overstatement to say that early diagnosis of cancer is the door to future care and treatment. This is a multidisciplinary and a consistent effort by all of us. Let's act in concert and spread the message of early diagnosis through coordinated campaigns. Let's erase cancer stigma. Let's now secure a healthier and more humane future for the generation to come by implementing early detection programs followed by access to effective treatment, and thus ensuring that every single patient stands an equal chance against any form of cancer worldwide. I would like to end with a message from my daughter Melina, hoping that no other kids experience what my kids have been through losing their father from lung cancer. Thank you.